Hello, Rob. Hello, my dear friend. Rob and Lori asked me to talk about sort of the basics of communicating about climate and health. I am delighted to do that. I do research on this topic. I instruct others. I do it myself all the time. So this is a really happy way for me to spend a lovely Saturday afternoon in April. They also asked me to give this standard disclosure, which I am doing. I took out my normal disclosure or conflict disclosure that I've been using with increasing frequently lately. And it's a disclosure that basically says that I've done everything I can to decarbonize my own life, including my home and my transportation. I've divested completely from 401k, and I use my work in every way I can to try to accelerate the transition to a 100% clean energy economy. And if that's not something that you feel I need to disclose, well, great. I feel like it's good to disclose it because it's possible that it compromises my judgment in some way, the fact that I'm so all in on this topic. Um, I have been a public health communication professional for 42 years now. For the past 17 years, I've worked on nothing but climate change as a public health threat and a public health opportunity. But my career in public health as a communication expert is much longer. And the one thing that I have learned with greater certainty than anything else I've learned during those 4 decades is that communication can be incredibly powerful. And the reason why I got my doctoral degree in communication scientist is because my intuition was that communication is a powerful asset to help us address the countries, our communities, the countries, and the world's biggest public health problems. And the one thing that I've learned with greater certainty than anything else is that when it works well, when communication is powerful, when it helps us achieve our health objectives, it always follows this formula. Simple, clear messages, repeated often by a variety of trusted and caring voices. Nothing I've ever worked on in my whole professional life was ever simple. Certainly climate change isn't simple. Certainly the health relevance of climate change isn't simple. But if we want to be effective in our use of communication, we really have no choice but to find ways of simplifying the complexity of the issue. Because people, the human mind doesn't deal well with complexity. Complexity is an anathema to effective communication. So from a communication point of view, no matter how complicated the topic we're working on, we need to strive to make it simple. And some people blanch at that idea. Some highly trained experts, like all of you, I'm not saying you all of you blanch at that idea, but you are all highly trained experts, and highly trained experts tend to shrink back from the notion that they should simplify what they know because they fear it is dumbing it down. But I would contend it's just the opposite. When we are expert in a topic, if we're capable of simplifying what we know, it means we're smartening it up. We're smartening up our communication. So that is what we need to do. But why do we need to repeat it often? Repeating ourselves is boring. If we wanted to repeat ourselves, we would have become politicians. But I don't know about any of you in the room, but I choose not to be a politician. I couldn't stand the necessity of saying it over and over and over and over again, the way every successful politician does. But as a communication scientist, I've learned that it's absolutely a necessity. It takes many, many, many exposures to a given simple, clear message for it to sink in to people, for people's to start to process what it means, to start to reorient other things that they know vis-a-vis this new thing that we're trying to share with them. There's some research, the best piece of research I know on the optimal frequency of repeating climate messages. And the answer to that question, despite the fact that this is the best study I've seen, the answer to the question is we don't know. This particular study tested message frequency up to 83 times per month. That's about 2.5 times per day, repeating the message. And with every exposure up to 83, they continue to get more return on investment. People who are more likely to take the recommended actions. So we don't know what the optimal message repetition is, but we know it's something more than 2.5 times a day. And then finally, the final component of this formula is the messages have to be coming from trusted and caring voices. And the reason why that is obvious. If we don't trust the communicator, if we don't think the communicator cares about us, we're going to have very little motivation to listen to what they have to say. And so, from a communication effectiveness point of view, our biggest asset is if we are trusted and if we are seen as caring. So, this is the formula: simple, clear messages repeated often by a variety of trusted and caring voices. Part of my day job. Go ahead. No, sorry, I thought I heard a question. If there are questions, maybe somebody at the microphone could shout them out. I don't mind being interrupted. I run a public opinion poll with my colleague and friend Tony Leiseritz at Yale. We've been doing this every 6 months since 2008. It's called the Climate Change in the American Mind poll. And what we learned in 2008, and what is still true, but to a lesser extent today, is that most Americans accept the reality that climate change is happening, except until recently, they tended to see it as a distant threat, distant in time, so a future problem, not today's problem, distant in space, somewhere else, maybe somewhere on the planet that I'm not entirely sure I could point to on a map, and ultimately distant in species. Absolutely polar bears, but not so much people. These are three mechanisms that indicate the public systematically misunderstands the realities of climate change, because climate change is already happening. The impacts of climate change are already happening in every community in America and in every corner of the globe. And moreover, of course, they're happening to polar bears, but they're also happening to people. And my friends, that's what we're most capable of talking about: the ways in which climate change is touching the lives of people in our communities. When we conduct this poll, the Climate Change in the American Mind poll, before we ask any other questions about global warming, we ask this question: what's the first thing that comes to mind when you hear global warming? And the reason why we ask this question is because we think that people's top of mind association, which is what this question is seeking to get at, what's the first thing that comes to mind? What's top of mind for you? We think that's the single most important thing that they know about the topic, because people's top of mind association will color everything else they know. Cognitive psychologists have more technical ways of talking about it. They talk about mental model and schemata and what have you, but we're not going to do any of that today. We'll simply say that the people's top of mind associations are incredibly important. And what we've learned now in asking this question to over 40,000 people during 31 waves of this survey is that plants, penguins, and polar bears are the most common top of mind association, particularly polar bears. And it's not surprising, right? Not surprising at all why that would be the case. We've all seen so many different photos of polar bears associated with the topic of global warming on magazine covers and in news stories and everywhere else. So the fact that this is the middle of most people's mental models, this is on the top of the stack, so to speak, not surprising, but not terribly helpful. Because while many people care about polar bears, it certainly indicates they would see it as a psychologically distant threat. Because while we care about polar bears, we care about people more. We care about our loved ones, our friends, our family, our neighbors, much more than we care about polar bears. The second most common reference that we get is, I sort of bucket it as science references. References to things like the Keeling curve, the amount of CO2 in the atmosphere as measured on top of Mauna Kea. And these two, it's easy to understand why people would give us, essentially say science as the thing that comes to mind first. But like polar bears, it indicates that it's not a particularly personally relevant top of mind association, because science is abstract. Most people aren't scientists. Most people can't even name, actually, this is true. Most Americans cannot name a single living scientist, as sad as that would be. But it indicates that when they tell us in response to that question, science is what comes to mind, it's certainly indicating they see it as a distant thing. And then the third most common reference that we get is politics and politicians. And when we correlate what they tell us with where they are on the political spectrum from liberal Democrat to conservative Republican, we've learned that their reference to politics and politicians is almost always a reference to somebody on the other side of the aisle, the quote unquote other that unfortunately we often have feelings of antipathy towards. So this is yet another top of mind reference that indicates most people aren't seeing this as a personal problem. In this case, they're seeing it as another problem. This is the answer that I don't think we've ever gotten in 40,000 plus respondents. Top of mind association, the health of my child, or my health, or the health of somebody else that I know and care about. This is the top of mind association that I'm hoping that all of us can use our trusted and caring voices to create in Americans' heads. It won't happen overnight. As I said, it takes a lot of message repetition in order to change how people think, in order for these messages to influence how they think. But I can't see how many there are in the room, but there's enough of us that we stand to make there's a good chance that we can make a difference. And in fact, we already are. Here's another way that we've asked the question. What do you think is the greatest threat that global warming poses to the United States, if any? Again, it's another open-ended question. We didn't provide these categories. We just ask it flat, straight up, open-ended, and people type their answers into the text box in the survey. And this is slightly more hopeful than what I showed you a moment ago, because at least this time, 3% of our respondents in March of 2021 did indicate they saw health harms as being the #1 threat of global warming to people in the United States. But it's only 3%. Okay, so 20% said weather extremes and weather changes, and that's both true. And I would contend that that's helpful when people understand that the weather is changing in their community or in our nation and in dangerous ways. That is very helpful. And that actually can lead pretty closely to making the case that those extreme weathers, the changes in extreme weather, are also bringing with them health harms, both injuries and deaths in some cases. But still, the point I want you to take away is only 3% think about health harms as being the premier threat of global warming to us in the United States. But here's where the story gets really hopeful, okay? So far, my story hasn't been too helpful, but as of this slide, it takes a decidedly hopeful turn. Simple, clear messages repeated often by a variety of trusted and caring voices, right? So this is the question that we ask in our survey. This survey happened to be April of 2022. And the question is down in the bottom bottom left. How much do you trust or distrust the following as a source of information about global warming? And we randomize the order, so no two people see the order of these people in the same way, and we have them rate how trusted they are for each of these. And I've excluded the non-voters. I'll tell you why if you want to know, but for now, this is only voters, but that's about 85% of people are voters. And you can see that over on the left, we look at all voters, people say their primary care doctor is their fourth most trusted source of information about global warming, following NASA, which is the strongest science brand in America and arguably the world, and it might even be one of the strongest brands overall in America. Really, it's extraordinary how respected NASA is. But friends and family are #2, climate scientists are #3, and people say their primary care doctor is their next most trusted source. Now, I want you to look across the slide and don't get concerned when you see that your liberal Democrat friends trust their primary care doctors less, because these are rankings, okay? So in fact, if I were to show you the slide that showed the total proportion, there would be more liberal Democrats who trust their primary care doctor as a source of information than there would be conservative Republicans. But the ranking is really incredibly telling, because go all the way to the right of this slide now, the two right-hand columns, moderate Republicans and conservative Republicans. And you can see that for them, their primary care doctor, or I'll just like generalize a little bit, go out on a limb and say the health professionals in their lives that they have chosen to have a professional relationship with, they are highly trusted. As a matter of fact, they are more trusted in the case of conservative Republicans than any other source of information about global warming other than their friends and family, who tend not to know very much about climate change. So what I take from this is that we, health professionals, have this extraordinary opportunity because we are not only seen as trusted and caring, but we're specifically seen as people who are trusted in terms of providing information about global warming. I don't think we should be going out of our lane and talking about the ecological impacts or the economic impacts. Although if you feel like sufficiently expert to do so, feel free. But our lane here is the way climate change is harming our health, and the ways that taking action on climate change will be profoundly good for the health of people in our community, our loved ones. And as you'll hear me say in a moment, it's a really compelling story because unlike the climate benefits, which takes months, which take years or decades to accrue, the health benefits of climate action begin to accrue almost immediately. So now let's jump to the simple, clear message part. In analyzing our survey data over many, many waves, 30, 31 waves of the survey, we've learned that there are six key, what I call now truths, six key truths about global warming that can be expressed simply and clearly in 12 words, in fact. And these six key truths are strong, strong predictors of where a person falls in terms of their support for climate action and their willingness to get involved in pulling for climate action. And the strongest predictor, unfortunately, is their political ideology, where they fall on the political continuum from far left to far right. But the second level predictors are these: believing that global warming is happening, which is true. All of these are true, so I won't repeat that. But understanding that it's happening, understanding that human activity is the main cause, and by human activity, I mean burning fossil fuels, understanding that there is an overwhelming consensus among the world's climate experts based on evidence that human activity is warming the planet, understanding that it's bad, it's causing harm, and in the case of the story that we're capable of telling, and that I encourage you to tell, is it's bad for our health. It's bad for the health of our children and our seniors and the health of everybody, and especially the health of people who are in low income and communities of color, because they simply have worse exposures and fewer resources by which to protect themselves from those exposures. Next is that there's hope, that there are actions that we can take that will make a big difference. And finally, that others care. 7 out of 10 Americans are worried about climate change, yet they think they are in a small minority. This is a widespread, pervasive misperception that among the wide majority who care, they think that only a small minority care. And we've learned from our analyses that misunderstanding that truth about the social norm is unhelpful in a whole variety of ways. So I want you to think about these as six key truths, six simple, clear messages about global warming that we know help cultivate public readiness for effective climate actions, and they can be expressed in 12 words. It's real, it's us, experts agree, it's bad, there's hope, and others care. So now let's get down to that's the iteration of those six key truths that we can talk about. We uniquely can talk about because we're health experts, okay? So when we launched the Medical Society Consortium in 2017, prior to launching it, we did some message testing research to prepare our first publication, this medical alert report, which is up in the upper right-hand corner of the slide. And the way we prepared that is we took the 2016 National Climate Assessment, I think that was NCA 4, and we took the information in the health chapter, dozens of pages of evidence-based assessment of the ways in which climate change is harming health in America today. And we found in that health chapter 8 different pathways by which climate change is harming health. making air pollution worse, making extreme heat worse, making extreme weather worse, vector-borne illness, waterborne illness, foodborne illness, increasing hunger and malnutrition, and finally, exacerbating mental health problems. And there was information in there about who is being hurt first and worst by these impacts of health impacts of climate change. And so what we did is we took these thousands and thousands of words and we distilled each of these pathways into an essay of about 150 words. We described what's happening to our climate, how's that harming our health in terms of, for example, how is that making air pollution worse, and whose health is being harmed first and worst by the exacerbation of air pollution. And we had people rate these essays on various dimensions that we thought were important, and we surveyed them before and after, and again 2 to 3 weeks later, after they had read these 850-word explainers. So that's about the total number of words they read was about the average length of an op-ed in a newspaper. So not a lot of words, but enough to actually deliver a lot of information that we knew most people don't have. And what we learned is that even 2 to 3 weeks later, having read those 1,500 words or however many they were, increased both their cognitive and their affective engagement with the issue. In other words, the issue became more personally relevant to them and more worrisome to them. And it was especially so with people in the middle of the political continuum, moderates, and people on the sort of the middle to right end of the continuum, moderate conservatives. This is a really cheerful finding, my friends, because it suggests that what I showed you a moment ago about who is trusted, you see that conservatives and Republicans say they trust us. Well, when we make the effort to inform them, in fact, it has a bigger impact with them than with liberals, which is really helpful because for you in the 406, I understand you've got a lot of conservative brothers and sisters out there, a lot of conservative neighbors. So I want you to know that the narrative that I'm starting to lay out for you is one that they are open to. But if we only talk about the health harms, the health risks, we're missing the better half of the story, because the better half of the story is the health benefits of taking action. And like I broke down the health risks into 8 different pathways, I break down the health benefits or the health policy solutions into 5 different pathways, that the actions that we individually and collectively can take that will pay dividends for our climate and will pay dividends for our health. And those 5 policy solution pathways are cleaning up our energy supply, pivoting away from fossil fuels and towards clean energy and reducing energy waste. Climate smart foods, farms, and food systems, clean and active transportation options, better buildings and homes, and better community design and land use. All 5 of these pay climate dividends and health dividends. And as I said before, when we talk about them as climate solutions, which we should, we have to understand that most people will hear them as, well, that's nice, but those benefits will accrue over, they won't accrue for many, many years, and they will accrue a little bit all over the world, which is true. But the health benefits of those actions, they begin to accrue almost immediately. And any community that takes these actions, they are the primary beneficiary, which is really important because people are much more interested in taking actions that pay immediate and local benefits as opposed to actions that take delayed benefits and are primarily benefiting others. So we tested these 5 messages about these 5 policy pathways solutions. We tested them in the context of all of those health impacts that I talked about a moment ago, those 8 impacts of health of climate change on health. We tested the 5 policy solution pathways, and we tested both of those 2 things, both with and without affirming a social norm. statements like, most people agree that we want healthy communities and a healthy climate, and many of us are taking action, or, but not enough of us are taking action. Either way, it was our read of the social science literature that you always want to invoke a positive social norm. Remember, I talked about others care before as that sixth key truth. So we literally tested 376 different message conditions, all 8 of the health impacts, all 5 of the policy solutions, and I believe it was 3 different ways of invoking the social norm. We found in our research that all of them increase message effectiveness. So you can't just do 1 or 2, you can, but the ideal message is a message that talks about the impacts, that talks about the benefits of taking action, and affirms a helpful social norm. And of those 3, the most important is talking about solutions. And this, much like the last study I just walked you through, this one was the impacts of these health messages, that the multi-layered health message were at least as strong for Republicans as for Democrats. It's not the case that it was stronger, but it was at least as strong for Republicans as Democrats, which again is very helpful. Our most recent study, we took because some of our colleagues in the health field felt like we were not talking about something really obvious and very important in this narrative, in that 3-part narrative. And that obvious and important thing is, well, if these health and climate policy solutions are so good, why aren't we implementing them already? What is standing in our way? And what is standing in our way are the opponents to climate action, fossil fuel CEOs and their lobbyists, politicians. And so we tested that this climate narrative that had these 3 elements, both with and without, calling out fossil fuel CEOs, the lobbyists, and the politicians who are in their pockets. We actually tested it in 3 different ways. So we isolated which of those 3 was the best. Turns out it's almost indistinguishable. What we learned is that it helps. It strengthens our message effectiveness, the effectiveness of the climate health narrative, when we call out fossil fuel CEOs, their lobbyists, and the politicians who are in their pockets as the people who are standing in the way of the very policies that are so important to the health of our health and the health of our climate. And it was, ironically and quite delightfully, it particularly strengthens our message with Republicans and independents. So calling out the opposition is a wonderful way for us to call Republicans and independents into this conversation with us. It's a fantastic thing. I'm going to go back in time just a little bit. Before we did some of these studies, we also looked at, we took climate change off the table for a minute, and we looked at how to talk about the emerging evidence about how just exposure to air pollution harms health. Because there are plenty of people out there, I'm sorry to say, who just don't feel comfortable talking about climate change, but they do feel comfortable talking about air pollution. And so, almost all Americans in research indicate that they understand that air pollution is bad for our lungs, maybe bad for our heart, but that's about the extent to which they understand the ways in which air pollution is harming health. In fact, there is a much more terrifying set of health impacts, neurotoxic impacts of exposure to air pollution. For children, they tend to be neurodevelopmental impacts, things like greater risk of being born prematurely, greater risk of developing ADHD, greater risk of being on the autism spectrum. And these are impacts that can last a child's entire lifetime. So they aren't transient, they aren't acute, they are chronic and in many cases permanent. And so those types of impacts we intuited would be particularly important to people if we made the effort to share that information with them. So we took the current epidemiology as of 2018 on the health impacts of climate change. We developed a whole range of simple, clear messages. We tested them with a cross-section of the American public, and we found that lots of these impacts were of grave concern to the American adult population, but especially the neurodevelopmental impacts on children. So even older adults our messages for older adults talked about enhanced risk of developing Parkinson's and Alzheimer's and other forms of dementia. Pretty terrifying stuff for somebody my age. But even people my age, the older demographic, we still said that the impact of greatest concern to us was that health harm to children, including children who are born pre-polluted, children who are exposed to air pollution through a placental exposure through their pregnant mother. So let me close here. Maybe we've got enough time for a couple of questions, but I just want to reiterate. This is our challenge. This is our lane. Climate change, in my view, is the defining public health issue of our time. So there's just no way that we can be responsible health professionals unless we link arms and lean into this issue. This is our greatest health challenge. It's also our greatest health opportunity. And the beauty of it is, as I hope this research has helped convince you, that when we use our caring and trusted voices to talk about the ways in which climate change harms health and the health benefits of climate action, it makes the problem personal to people in ways that no other way of explaining it does. It brings the benefits of solution into the present and into our community in ways that no other narrative does. We, and perhaps we uniquely, can call out the opposition, and we've learned that doing so is helpful and actually builds public trust in us. And we've learned that it depolarizes the issue. Perhaps we uniquely have the opportunity to bring Americans on the left and on the right into a common adult conversation.